Here at USA Health Children's and Women's Hospital, our patient population is comprised of children ages 0 to 18. Those patients can be admitted for an acute situation where they might stay a day or two, or a chronic medical condition that might result in a much longer stay. My name is Beth Abston. I work as part of the MAP Child and Family Life program here at Children's and Women's Hospital. Child Life is specific to children's hospitals, and it is tasked with attempting to normalize the environment and make things less stressful for the children and their families while they're here. We work really hard to make sure that our patients are comfortable in the hospital by delivering video games and toys, and also by explaining what's happening in age-appropriate language, which is not something you would find in an adult hospital. Regardless of the length of stay, whether it's one night or multiple nights, all of our patients become part of the children's and women's family. It's not unusual for us to have patients come back for visits months later, years later. It's also not uncommon for some of our patients to even want to go into the medical field because of their experiences here. I'm often asked how I can work in a children's hospital and am I not sad all the time? But to be honest, the good always outweighs the bad, and I wouldn't give up the experiences and the opportunities to meet these children for anything. I feel as though if I can make even the tiniest difference in what might be a family's worst day, then I've done my job. And how can you not want to be part of an atmosphere like that? During the holidays, I think it's even more stressful for families to be inpatient at the hospital, at any hospital. It's not what they had planned for the holidays, and for so many folks, the opportunity to be around friends and family and be at holiday gatherings is so important. But when you're in the hospital, you can't do that. So we make sure that the hospital is decorated, the park is decorated, opportunities for fun little field trips out to the park to see the Santa hats on all the statues. There's an opportunity for a special patient to light the tree each year at our tree lighting event. So we try really hard to make sure anything that's happening in the community still happens here so that the kids don't feel like they're missing out on that as well. One of the things that is always so impactful to me personally are families who have been here as a patient, whether one night or for many nights, and they've had such a positive experience that they are led to give back to the hospital, and that often comes through our program. In this season of thankfulness, we would like to invite you to make a gift and join us in helping make a difference in the lives of our patients and their families. Thank you.